Hi there, it's Kathy again, and welcome to this video on the 12 Commandments, building a care plan when the system doesn't, or when the system seems to fail you. So in today's reality, families can no longer assume that services are going to be complete, consistent, or even reliable. The modern care landscape is fragmented and overextended and often misleading in what it promises versus what it delivers. Instead of trying to construct a perfect plan, the goal is to shift. Build a system that holds up when parts of it inevitably will fail. So these are the 12 commandments that I've learned over 50 years in the business and a total of more than 30 years as a family caregiver. So these commandments offer a grounded, practical framework for navigating care with clarity and resistance, but most of all, realism. So begin with a reality reset. Before making calls or applying for services, anchor yourself in the truth. This is the first commandment. Home care is not medical care unless you are specifically hiring licensed professionals. Also know that approval for care does not guarantee service delivery, and coverage does not guarantee continuity. What you are building is not a guaranteed solution. It is a patchwork support system. So by accepting this up front, it prevents false expectations and costly mistakes. Second commandment, define your non-negotiables. Before engaging in any system, identify 3 to 5 high-risk needs for you, your elder, your loved one. These typically include things like transfers from bed to chair to toilet, on and off, in and out, medication management, setting up or administering. There's a really key difference, especially in some service areas. Fall risk, and when is it most likely? Cognitive supervision, important with people with memory loss. And bathing, high risk area. The critical question is not how do we fill these hours, but where are we most exposed if no one shows up? So this reframes the whole planning process around safety rather than coverage volume. It's not about a one body, it's about safety. Third commandment, build a hybrid care model. Relying on a single agency or funding source is one of the most common points of failure. A realistic care structure layers multiple supports. Medicaid, if the person is eligible, is a baseline. Private caregivers to fill critical gaps, families and friends as anchor support when available, community resources through local councils on aging or other local organizations. This layered approach reduces dependency on one and only one fragile component. 4, take control when hiring private home care. Hope is not a strategy. When using private home care, prioritize consistency over variety. Fewer caregivers with longer, more stable shifts reduce fragmentation and eventually improve the results. Ask to interview the caregiver who will be providing care and invest in building relationships with 1 or 2 of these primary aides. In this level of care, continuity matters more than credentials. I spent years helping build private home care, working inside. I know it well. You can if you push back. 5th commandment, create a simple home care playbook. Know that turnover is inevitable, and therefore documentation becomes essential. Maintain a clear, accessible guide that includes daily routines, medication list, mobility instructions, and red flags that require escalation, such as when to call a family, when to call 911. This ensures continuity across changing caregivers and prevents knowledge loss. Know that no one agency owns the full care situation. You do. Sixth commandment, close the medication gap. You know, medication errors are the leading cause of emergency room visits. Do not assume that your caregivers will manage, not just remind, but manage medication unless they are specifically qualified and authorized. And this can vary from state to state. In my state of Massachusetts, aides are not allowed to give any medications. Families must decide whether to manage the medications, that's you, yourself, use a pharmacy prepackaging system, or involve licensed nurses, but this is an additional cost. Clarity around this one is critical. Seventh commandment, plan for no-show days. They will happen. They are not rare. They are predictable, and they are disruptive. Every care plan must include a backup strategy. Ask agencies, if you're working with an agencies directly, how they handle last-minute absences, how replacements are trained, especially if your loved one has a complex care situation. A plan that cannot absorb disruption is not a plan, it is a risk. Eighth commandment, use hospitals and rehab facilities strategically. Hospital discharges are a critical decision point. Do not passively accept discharge plans. Request a physical therapy and occupational therapy evaluation and insist on a realistic assessment of home safety. Avoid being handed brochures without guidance. Talking to people who have no experience and no background. They are out there. These pipelines can drive you crazy. Work with case managers to map the actual care needs to the available community resources before discharge and understand the difference between skilled home health care, private care, and assisted living. Many settings will accept patients beyond their capacity to manage, so your due diligence is essential. Talk to people who know what they're talking about. Ninth commandment, stay ahead of Medicaid changes. If Medicaid is part of the plan, know that the Medicaid program itself is not static. As a matter of fact, is shifting dramatically over the next 2 years. Rules are shifting, eligibility changes, administrative errors are common. Regularly review coverage status and anticipate adjustments rather than reacting after the gaps occur. Note too that most disruptions are bureaucratic, they're not clinical. Your loved one didn't just change in a couple of days. No, there was an error. 10th commandment, protect the family caregiver. If it's not you who is taking on this role, caregiving often concentrates on one individual, leading to burnout and illness and eventual breakdown of everything. If the primary caregiver fails, the entire structure collapses. Supporting the caregiver is not optional, it's foundational to sustaining your plan. 11th commandment. Know when the plan is failing. There are warning signs that the current situation, the current arrangement, the current plan is no longer working, such as increased falls, missed medications, weight loss without reason, dehydration, increasing confusion. At this point, adding more hours or adding more services really resolves the issue. A shift in a care setting or strategy is required. And the 12th commandment, accept the limits of the system and build community-based stability. For individuals living alone with limited resources, options really are constrained and becoming more so as we move forward into the year. State programs such as personal care services, PCA, homemaker support, adult day health services may help, but now are involving longer and longer wait lists and more limitations. Programs like PACE, which is the Program of All-Inclusive Care for the Elderly, PACE is the acronym, can offer integrated support only if you qualify. Subsidized housing with services does exist, but is limited, and in these situations, we're seeing fewer and fewer resources with subsidized housing, longer and longer wait lists. So across all of this, stability comes from combining multiple supports. Other things can include Meals on Wheels, faith-based groups, local networks, or you can work something into what I call a community stack that provides enough coverage to maintain safety. The central premise is this: stop trying to force a fragmented system to behave like a coordinated one. Instead, design care with the expectation of gaps, disruptions, and inconsistencies, because that's what you're going to get. A workable plan is not the one that looks complete on paper. It is the one that continues to function when pieces of the plan fall away. And in a closing note, please be careful of who you get advice from. Always follow the money. If someone is being paid to refer you to a specific place, you are no longer a client. You are a product. So get information from people who know what they're talking about, and realize that no matter your situation, there are going to be inconsistencies and disruptions. And if you plan for them, they will cause you less heartache.